Swadika and good afternoon, and welcome back to the English language summary of the daily press briefing on the COVID-19 situation in Thailand, live from the Center for COVID-19 Situation Administration, or the CCSA. For today's briefing, which is Friday, the 25th of June, 2021, let me start with an update on the number of vaccines that have been administered since the start of that vaccine drive on the 28th of February 2021. As of yesterday, which is the 24th of June, Thailand administered 257,103 doses of vaccines. And this brings us to a total of 8.6 million doses, actually a little bit more than 8.6 million doses already administered so far, which is equivalent to 12% of the whole population. And among this number, 2.45 million or 3.4% of the population have already received their second doses. And our target for June is again for 10 million doses. And we do hope that we can achieve this goal very likely by the next week. Also in the Bangkok metropolitan area, which has the highest rate of infection right now, 19.5% of the population have already received their first dose of the vaccine, and almost 9% have received their second doses already. And in Phuket, we are also preparing for the Phuket sandbox scheme to start on the 1st of July. 63, almost 64% have received their first dose of the vaccine, and almost 50% have already received their second dose. So the rate of vaccination in Phuket is progressing very well. Moving along, allow me to talk about the general number of statistics. As Dr. Apisamai had just kindly briefed to us, we have today the number of new confirmed infections standing at 3,644 cases. From that number, 162 come from penitentiaries, so this leaves us with a total number of active cases of patients now being treated at medical facilities standing at quite a high rate at 41,386. In this number, 1,603 are in critical condition and 460 are on ventilators. This is, of course, a very alarming number to us, and we are addressing the issue quite seriously. We have a number of new recoveries standing at 1,751. So that leaves us with a total number of recoveries standing at 193,106. Excuse me. Today's number of new fatalities stand at 44, and that brings us to a total number of fatalities standing at 1,819. I'd also like to brief you a summary of what Dr. Apisamai just mentioned to us right now. We see that the number of cases in Thailand continues to stand around about 3,000 cases per day. Most of the cases located in Bangkok and surrounding provinces, as well as provinces in the south of Thailand. So let me show now you screen. Yes, on the screen you can see now we have a slide on the number of the provinces with the highest number of cases. The top 10 provinces right now are Bangkok, which is which has reported 1,142 cases, Samut Sakhon with 295, Yala with 215, which is slightly higher than yesterday, Pathum Thani standing at 192 cases, Samut Prakan has 186 cases, and this is on a downward trend. Also today, there are 11 provinces that have reported 0 cases. Particularly still quite as a case of concern is still within the Bangkok metropolitan area. There are reports on higher number of serious pneumonia cases among the COVID-19 patients in the past 7 days. And today we've also reported 8 new clusters within Bangkok, and they are, as usual, still within places with crowded communities, factories, markets, and construction camps. And the CCSA is closely monitoring right now 107 clusters of infections within Bangkok. The CCSA continues to closely monitor the situation in parallel with daily assessments on hospital capacity and the availability of hospital beds, especially for patients in critical condition. We are working right now on increasing medical facilities and beds for those patients, and by next week we would already be increasing quite hundreds of beds. Also, I'd like to remind everyone that our priority is to save people's lives as well as people's livelihoods as much as possible, and that is a balance that we need to consider very carefully. And therefore, the CCSA is listening to all concerns and proposals from the public and the private sector, including a proposal for temporary lockdowns in targeted high-risk areas of Bangkok. Due to the recent surge in local transmissions, the Prime Minister, who's heading the CCSA himself, will consider this proposal today at 2 p.m., as Dr. Apisamai just mentioned right now, together with his close advisors and experts. And he will consider this in tandem with other surrounding factors. And of course, we need to consider such proposals with extra care, because even lockdowns, even if they are targeted, they still can affect many segments of society, particularly those who are already economically very vulnerable. And this is why the Prime Minister and all of us at the CCSA will think about this very carefully, and we will bring updates to you as soon as we have them. Moving along, I'd like to also address some concerns that were raised in social media about what happens when Phuket is opened with the Phuket sandbox, and if there are scenarios of infections. So while we're still waiting for Phuket Sandbox details to be published in the Royal Gazette, I'd like to share some additional information to address this concern. Yesterday, the Phuket Tourist Association informed us that 7 COVID-19 test centers will be set up across the island to facilitate tourists for COVID testing. And these COVID tests can be administered with a cost of 2,800 baht per test, which is quite low. And if visitors want to use test services at hospitals, they can also do that. And the cost would be within the range of 3,500 baht. And in order to get these tests, visitors must sign a consent form in advance. and allow the lab to send results to the Phuket Sandbox Command Center. And this is important because if the positive result is detected, the hotel manager from wherever the visitor is staying at will relocate the guest to the hospital for treatment and monitoring. Tourists who test positive upon arrival at the airport will also be sent to an alternative local quarantine facility. So this is just to remind everyone that we do have measures in place to address any risk scenario. Now, allow me also to bring an important notice on some research findings on Sinovac vaccines. The National Vaccine Institute has recently revealed that according to research jointly conducted with the Thai Red Cross Emerging Infectious Diseases Health Science Center of Chulalongkorn Memorial Hospital and the U.S. Armed Forces Research Institute of Medical Science, they found that about 95% of those who have received 2 doses of the Sinovac vaccine have developed an immune response which prevents the spread of SARS-CoV-2 or COVID-19. And therefore, the National Vaccine Institute informed that there is no need for the general public to test their own immune response. And it is advised that the public should seek recommendation from physicians should they think, if they need any immune testing after vaccination. So please leave this to the physician to decide whether this is necessary or not. And we'd like to remind the audience, just as Dr. Apisamai just mentioned right now, that vaccinations do not guarantee 100% protection from contracting the virus, but it will reduce the risk of severe symptoms and death caused by SARS-CoV-2 should you ever contract the virus. And therefore, we encourage the general public to get vaccinated as soon as possible. And also, we are aware that many are still waiting their turn to be inoculated, and we ask for their patience and understanding as we proceed with our vaccine drive according to plan. Now, on the next slide, to allow some positive, yes, there we are. Yes, I'd like to bring to your attention that while the government and the CCSA is working hard with private sector and all segments of society, there are also small but very important efforts made by the society because COVID-19 has caused economic hardships and led to more than 3 million fatalities worldwide. And therefore, the fighting spirit and the spirit of community service is very important, and it still runs very strong in many communities who have continued to make a difference by assisting others. And so many who have lost their jobs from COVID-19 now rely on community kitchens, and it is heartening to see that many community outreach initiatives are taking place that support vulnerable groups, including, which you see on the screen, the SOS, which is the Scholars of Sustenance Foundation of Thailand, and the Bangkok Community Help Foundation. They've been helping to combat hunger by gathering food supplies and distributing them to these communities. So a great shout out and thank you to you. So before I go, let me close with an infographic from the World Health Organization on advice to avoid enclosed and crowded spaces You'll see the slide on the screen very soon. So the advice is to avoid these crowded and closed spaces if it's necessary for you, and if you need to leave the house. And always wear a mask, keep your distance, and wash your hands as always. There you go, there's the infographic. So it's a combination of vaccines and practicing DMHTT, avoiding closed spaces, and wearing masks at all times that will keep you safe from COVID-19. That's all I have for you today. Thank you very much for your kind attention. ขอบคุณค่ะ สวัสดีค่ะ